Councilor Colleen, in a moment, yeah. Well, we're going to skip that. We appreciate you coming in.
Do you want me to come up after?
Yeah,
Okay.
we'll appreciate that. Okay, cool. So, Colleen James is a regional councilor here in the region of Waterloo. She's the founder of Democracy in Action, a community initiative dedicated to strengthening civic participation and amplifying community voices in the Waterloo region. She's been doing this for over 15 years. 15 years of municipal government experience is what she brings to the table. She works to break down barriers to engagement and ensure all residents feel included in shaping their community. Colleen is also the founder of Dignify Incorporated, where she partners with organizations locally and globally to advance equity, inclusion, and systemic change. She has been recognized for her leadership. Colleen received the 2024 Public Services Excellence Award from the Women of Dignity International and was named the Woman of Influence in Local Governments by Municipal World. Born and raised in the beautiful city of Kitchener.
Bringing together community. At the heart of everything is community. We often talk about home and homes and, all of that. And I think, the fundamentals, the foundation of a home is the community, who you are with, the people you are with. And that's exactly what Equity in Action looks like, cancer awareness and education, the community and the people around you. So as a regional councillor, I see every day how health outcomes are not just shaped by biology, but by systems, by access, by trust, by income, by lived experience. And when we look at cancer through that lens, the disparities, they are clear. Data in Canada and across comparable jurisdictions shows that Black communities often face later stage cancer diagnosis, lower screening rates, and poorer outcomes for certain cancers. Black individuals are more likely to be diagnosed with more aggressive forms of cancers like prostate cancer and are less likely to be screened early, often due to systemic barriers, lack of culturally relevant care, and historically, the mistrust of healthcare systems. So this is about structural gaps, how we address those structural gaps. And events like today directly respond to those gaps by providing culturally relevant education, addressing stigma, and connecting people to trusted resources. So you are shifting outcomes in real time by being here today. You are making prevention possible, early detection more likely, and survivorship more equitable. Here in Waterloo Region, through our Community Safety and Wellbeing Plan and our partnerships in health and social services, we recognize that health equity is foundational to thriving community. When one group faces barriers, it impacts all of us. And when we remove those barriers, we all benefit. So thank you, Alliance for CancerCare Equity, for inviting me here today to be a part of this important conversation, and for all of you for showing up, because part of how we address systemic barriers, address prevention, ways to work within the system is coming together as a community. So thank you very much, everyone.
We need to be on this land and affirm our commitment to improving reconciliation real in our community. And I'd like to take a moment just to invite you to reflect on how you can benefit from the land. For me, that takes place in how I use the water, how I engage with the land, how I appreciate the land. Whether it be just appreciating the land underneath my feet, or whether it be simply taking a moment to appreciate the sun on my face. So I hope that you enjoy today, and I will pass it off to our other MC, Io, to do the introduction of the ACCE and today's event purpose.
Well, thank you, Blair. Thank you, Colin, too. So, ACCE, good morning and welcome everyone to this program, Empowering Communities, a cancer awareness and education event. Today's event is hosted by the Alliance for CancerCare Equity, ACCE, in collaboration with several valued partners, including the Waterloo Wellington Regional Cancer Program, the KW4 Ontario Health Team, SCOPE, the KW Immigration Partnership Council, the Guinean Canadian Association Waterloo Region, and the International Migration Research Center. The Alliance for CancerCare Equity is a Canadian registered charitable organization committed to improving access to equitable cancer care, particularly for the underserved population, including Black Canadians, immigrants, and other racialized communities. ACCE was founded on a simple but powerful belief: where a person lives, what they earn, or their background should never determine the chances of surviving a cancer diagnosis. Through education, advocacy, community engagement, and direct financial support, ACCE works to bridge gaps in cancer prevention, screening, treatment, and survivorship. The purpose of today's event is to bring our community together to increase cancer awareness, encourage early detection and screening, and empower individuals with knowledge and resources needed to navigate the healthcare system with confidence. It is also an opportunity for open dialogue, addressing cultural needs, reducing barriers to care, and ensuring that everyone in our community has access to the information and services they need. Most importantly, today is about, empowering communities. So I was going to point to the initial slide that we had, but don't worry about that. Most importantly today is about empowering communities with knowledge, connection, and hope. This is more than an event, it's a step toward health equity, informed communities, and lives saved. Thank you all for being here today and for being a part of this important conversation. Thank you. So the next item on our agenda today is I'm going to invite one of the friends of the organization to give opening remarks. She's the director of the Waterloo Wellington Regional Cancer Program, the Ryan Cancer Center. Join me as I introduce to you Sarah Connie. Before Sarah comes up, just 1 second, let me just tell people who you are. Okay, Sarah has over 30 years of experience working in cancer care and over 20 years of experience working in various leadership positions within the Waterloo Regional Health Network, which it used to be the Grand River Hospital, Grand River and St. Mary's. So they ran Cancer Center, including clinical manager of the radiation treatment program, interim clinical manager of outpatient oncology clinics, interim director of diagnostic assessment, screening and surgical oncology programs, and clinical educator, radiation treatment program. Sarah has a strong strategic and operational skill. Has strong strategic and operational skills and has participated in advancing cancer care at the regional and provincial levels. Please join me as welcome Sarah Connie.
Good morning, everyone. Thank you. Thank you for the wonderful introduction and for the opportunity to share some welcome from the Cancer Center. Not just the Cancer Center down the road, but from the whole regional cancer program. So I want to just share some initial thoughts, and Colleen actually already gave a lot of great information that I think it really emphasizes why it's so important for us to be here and how grateful we are actually for the opportunity to participate today in this event. So I'm here not just on behalf of the Cancer Center, but as I said, for the whole regional program. Dr. Ernest Osai and I have been working together for, I don't even know how many years now, probably over 20, maybe 25. So this is just a great opportunity to share our joint knowledge and joy from working for the cancer program in an event for the general public. So we're really pleased to be here. It's also wonderful to see about, I'm hearing between online and in the room, you have probably about 150 participants today, which is fantastic. It's also wonderful to see many of our healthcare providers here today. We've got some between our doctors, nurses, dietitians, mammographers, from our clinical trials program. We're just, and all the other folks who help support us. Roz, good to see you here today. I know she'll be talking as well. So we're really pleased that we're going to be able to share what we have from our experiences of working in the cancer program. I'd also like to acknowledge the cancer survivors that are here today, some of whom you're going to hear their stories. Thank you for sharing your personal experiences with cancer to help others who may face or are currently facing a cancer diagnosis. We're here today to talk about cancer, and cancer is the leading cause of death, a leading cause of death, with 1 in 2 Ontarians expected to develop cancer sometime in their lifetime. So it will really touch about every one of us, if not ourselves, but our someone we love. The most common cancers are breast, lung, and colorectal. And the rates are continuing to increase in some areas and declining in others, thankfully. But it will continue to be an area that we will continue to need to support in our region. When we talk about cancer in the Black community, we have some statistics, but it's by no means a complete picture. For example, in breast cancer, research from Canada and the United Kingdom shows that Black females are more likely to be diagnosed with more aggressive and faster growing subtypes of breast cancer that could be harder to treat. And research from Canada and the United States also show that Black females are more likely to die from breast cancer than white females. In the United States, the American Cancer Society indicated in a 2022 journal article on the impact of cancer deaths in the Black community that collectively, African American and Black people have a higher mortality than any other broadly defined racial or ethnic group for most cancers. This is why it's so important to have events like this to ensure we're addressing these disparities. Early detection can save lives. Early detection can help identify cancer sooner when they are easier to treat. Today you'll learn more about cancer screening, and I encourage you to visit the booth that we have on cancer screening. And we've got a team here from the Regional Cancer Program who can share all kinds of resources with anybody today on cancer screening. I want to acknowledge the Alliance for CancerCare Equity for sponsoring this event. The ACCE's mission is to promote equity in cancer care from prevention through survivorship, providing comprehensive support to patients and families facing the challenges of this life-threatening illness. We are so happy to be here today to support this mission and share how patients and families can access the care they need from prevention through survivorship. I'd like to also acknowledge the other folks that are here today, which have already been highlighted, but just to highlight again, the KW4 School Program, the KW Multicultural Center, Just Like Family Home Care, and Hope Spring. There are several staff from the Regional Cancer Program and the Cancer Center who are in the morning and afternoon will participate in moderated sessions to share how patients and caregivers can navigate accessing cancer services in our region, whether it's screening, diagnosis, or treatment. The experience of cancer can be overwhelming, and the ACCE has put together a wonderful panel of speakers to share their knowledge and experience, to show that there are supports and services to help make the experience of cancer better for patients and families. I encourage you to use the day to ask questions, make connections, and explore the resources. Similarly, for us as the healthcare providers here today, this is a good opportunity for us to ask questions, make connections, and learn how we can better serve the folks of this community and beyond into the whole region. Thank you for the opportunity to connect and share our experiences today. And thank you once again to the ACCE for being this important event.